For years, you have probably heard the same advice. If you have high blood pressure, put down the salt shaker, cut sodium, and your numbers will come down. Simple, right?
That is exactly what my doctor told me 10 years ago. I bought low sodium everything. I stopped adding salt to my food. And honestly, my blood pressure barely budged.
And you are not alone. That is the myth this episode is going to challenge. The research shows that for many people, sodium restriction alone is not enough. And in some cases, the real driver of hypertension is something most of us never even think about.
Okay, I need to hear this. I have been blaming my salt shaker for over a decade.
Welcome to Longevity Lab. I am Claire, registered nutritionist.
And I am Robert. Claire, I have to say, when you told me the topic for today, I thought I already know this one. Cut salt, done. But you said there is more to it.
There is a lot more to it. And the reason so many people struggle with blood pressure is that we have been focusing on one single target when the science tells us the real solution involves multiple targets working together.
So let me ask the obvious question first. Does salt even matter?
It does matter. Let me be clear about that. Sodium does play a role in blood pressure regulation for a subset of people. About 1/3 of people with hypertension are what researchers call salt-sensitive. For them, reducing sodium intake can produce a meaningful drop in blood pressure.
1/3. So for the other 2/3, 4 millimeters.
4. And clinically, while that is not nothing, it is not the dramatic change most people expect, especially compared to what other lifestyle interventions can achieve.
So the common advice was correct for some people, but incomplete for most.
Exactly. And that is the problem with one-size-fits-all health advice. The person who benefits most from cutting salt alone is the person who happens to be salt-sensitive. But if you are not, you could follow all the low-sodium advice in the world and still have hypertension.
I am starting to feel a lot less frustrated with my old efforts. So what actually works?
Let me start with something that surprises most people. The most studied dietary approach for lowering blood pressure is not about what you take out. It is about what you put in.
Okay, I am listening.
The DASH diet. DASH stands for Dietary Approaches to Stop Hypertension, and it was developed specifically for this purpose. The research on DASH is so strong that the American Heart Association, the National Institutes of Health, and the World Health Organization all recommend it as a first-line intervention for high blood pressure.
I have heard the name, but honestly, I never really knew what it was. Is it just another low-salt diet?
That is the most common misconception. DASH is not a low-sodium diet. It is a high-nutrient diet. It emphasizes foods that are rich in potassium, magnesium, calcium, and fiber. And the mechanism is beautifully straightforward.
So it is not about restriction. It is about adding the right things.
Exactly. Let me explain the mechanism. Your blood pressure is regulated in large part by your kidneys. They control how much fluid stays in your blood vessels. Potassium and sodium work as a team. When you consume more potassium, your kidneys excrete more sodium. More sodium leaves your body, more fluid leaves with it, and your blood pressure drops.
So by eating potassium-rich foods, I am essentially helping my body flush out excess sodium naturally. 11.4. Compared to 4 from salt restriction alone.
Almost 3 times the effect, and that was without any sodium restriction at all. The participants ate their usual amount of salt. The only change was the composition of their diet.
I have to sit down for a second. So I spent 10 years obsessing over a salt shaker when I could have been eating foods that help my body naturally regulate its own balance.
That is the empowering part, and the foods that make up the DASH approach are not exotic or expensive. Vegetables, fruits, whole grains, lean proteins, nut seeds, and low-fat dairy. foods most of us already have access to.
So, what does a dash plate actually look like?
Think of it this way. A dash style meal has about half your plate filled with vegetables and fruits, about a quarter with whole grains like brown rice, quinoa, or oats, and about a quarter with lean protein like fish, chicken, beans, or tofu. You include a serving of low fat dairy daily, like yogurt or milk, and you add a handful of nuts or seeds most days.
That honestly sounds like what I always thought a healthy plate should look like.
That is because it is. DASH is not a fad diet. It is a return to what human beings evolved to eat, and the research supporting it has only gotten stronger over time. A 2023 systematic review and meta-analysis in the journal Nutrients looked at 30 clinical trials involving over 3,200 participants. The consistent finding was that DASH produced clinically meaningful reductions in blood pressure, particularly in people with established hypertension.
Okay, so dash is step one. What is step two?
Step 2 is weight. And here the data is even more striking. Excess body fat, particularly visceral fat stored around the organs, creates a physiological environment that raises blood pressure in multiple ways.
I knew weight played a role, but tell me the mechanism.
Visceral fat is metabolically active. It releases inflammatory compounds. It activates the renin-angiotensin-aldosterone system, which is your body's blood pressure control system, and it compresses the kidneys physically, making it harder for them to regulate fluid balance.
So, losing weight changes all of that.
It does. And the amount of weight loss needed to make a difference is smaller than most people think. The research consistently shows that a weight loss of 5 to 10% of your starting body weight produces significant reductions in blood pressure.
5 to 10%. So, for someone who weighs 200 pounds, that is 10 to 20 pounds.
Correct. And the effect is dose dependent. More weight loss produces more blood pressure reduction, but even 5% produces real change. A 2019 study in the Journal of the American Heart Association found that participants who lost 5% of their body weight reduced systolic blood pressure by an average of 9 millimeters of mercury,
9. That is more than salt restriction.
more than twice the effect of sodium reduction alone. And when you combine DASH with weight loss, the effects are additive.
So, what is the practical approach? I have been trying to lose weight for years, and it is not that simple.
That is the honest truth, and I appreciate you saying it. Weight loss is not simple for most people, but the research on what actually works for sustainable weight loss in the context of blood pressure management is clearer than most people realize.
Tell me, what does the data actually show?
The most effective approach for weight loss, combined with blood pressure improvement, involves three things working together: dietary quality improvement, structured physical activity, and behavioral support.
That sounds like a lot.
It does, but let me break it down into specifics. Dietary quality improvement does not mean counting calories or following a strict meal plan. It means shifting to the DASH style pattern I described earlier. When people focus on the quality of their food and not the quantity, something interesting happens. They naturally consume fewer calories.
Because the food is more satiating.
Exactly. Vegetables, fruits, whole grains, and lean proteins are more filling than processed foods. People who shift to this pattern often lose weight without deliberately restricting portions.
I have experienced that personally. When I eat a big salad with grilled chicken and quinoa, I feel full for hours. When I eat a sandwich from a shop, I am hungry again in 90 minutes.
That is the mechanism of sati. Fiber and protein slow digestion and regulate blood sugar. Processed foods spike blood sugar and crash it, triggering hunger. So the DASH approach supports weight loss through a biological mechanism, not through willpower.
That is a completely different way to think about it.
Now let me talk about exercise, because this is where another common misconception lives.
I have always heard that cardio is best for blood pressure.
That is true, but incomplete. Cardiovascular exercise does lower blood pressure. Walking, jogging, cycling, swimming. These produce an acute drop in blood pressure that can last for several hours after exercise.
The post exercise blood pressure dip.
Exactly. Researchers call it post exercise hypotension, and it is clinically meaningful. A single session of moderate intensity aerobic exercise can lower blood pressure by 5 to 7 millimeters of mercury for up to 24 hours.
So every workout has an immediate effect.
It does, but here is what most people do not know. The type of exercise that may be even more effective for blood pressure is isometric resistance training.
Isometric. Hold that position.
Yes, exercises where you contract a muscle without moving the joint. Planks, wall sits, static lunges. A 2021 systematic review and meta analysis in the British Journal of Sports Medicine found that isometric exercise produced larger reductions in blood pressure than aerobic exercise or dynamic resistance training.
Larger than jogging?
Larger than jogging. The average reduction from isometric training was about 8 millimeters of mercury systolic. Compare that to about 3 to 5 from moderate aerobic exercise.
I have never heard that before. So I should be doing wall sits instead of my morning walk?
Not instead of, ideally in addition to. The evidence suggests the best approach is a combination. Aerobic exercise gives you cardiovascular conditioning, metabolic benefits, and the post exercise blood pressure drop. Isometric training adds an additional blood pressure lowering effect that aerobic exercise alone does not provide.
So what does that look like in practice?
The research based recommendation is at least 150 minutes of moderate intensity aerobic exercise per week, spread across at least 5 days. So 30 minutes a day, 5 days a week. Add 2 to 3 sessions of isometric exercises per week. Each session includes 4 sets of 2-minute holds with 1 to 4 minutes of rest between sets.
Okay, I can do that. I can add wall sits and planks to my routine.
And the beauty of isometric exercises is that you can do them at home, no equipment needed. A wall sit requires a wall, a plank requires the floor.
This is genuinely changing how I think about my daily routine. I have been doing the same walking routine for years, thinking it was the best I could do.
Walking is excellent. Please do not stop walking, but adding isometric work gives you an additional tool.
You mentioned stress earlier. How does that factor into blood pressure?
Stress is a significant contributor, and it is the one that people often neglect because it feels vague. Chronic stress activates the sympathetic nervous system, the fight or flight response. This causes blood vessels to constrict and heart rate to increase. Over time, this creates sustained elevation in blood pressure.
So my daily stress is actually raising my blood pressure beyond what diet and exercise can fix.
It can. And this is where the research on stress reduction for blood pressure is particularly interesting. The most studied intervention is mindfulness based stress reduction.
Mindfulness, like meditation.
Meditation is one form. But MBSR is a structured 8-week program that combines meditation, body awareness, and yoga. A 2022 meta-analysis in JAMA Network Open looked at over 1,200 participants and found that MBSR produced an average reduction in systolic blood pressure of about 5 millimeters of mercury.
5 millimeters from just stress reduction.
5 millimeters. And again, that is additive to what diet and exercise achieve.
So the full picture is DOS plus weight loss plus exercise plus stress reduction.
That is the evidence-based package. But let me be realistic with people who might be overwhelmed by that list. You do not have to do everything at once. The research shows that making even one change produces measurable improvement, and each additional change produces additional benefit.
What would you say is the single most impactful change to start with?
If I had to pick one intervention to start with, it would be the DAS diet. Because it produces the largest effect size, it supports weight loss, it does not require willpower because it focuses on what to eat rather than what to restrict, and it is something you can start doing immediately at your next meal.
At your next meal. I like that. Not next week, not after you buy special foods. Your next meal.
Your next meal. You can make one DAS-aligned choice today.
Give me a concrete example. What would you tell someone who is sitting in their kitchen right now?
I would tell them this. If you are having dinner tonight, aim to fill half your plate with vegetables. If you usually have meat and potatoes, add a side of steamed broccoli or a salad. Replace white rice with brown rice. Or if you usually have a sandwich for lunch, add sliced avocado and tomato and have an apple on the side.
Small shifts.
Small shifts that compound over time. A 2020 study in the American Journal of Clinical Nutrition followed participants who made gradual DAS-style changes versus those who made a complete overhaul. After 6 months, the gradual group had better adherence and comparable blood pressure reductions.
So slow and steady actually wins the race.
In this case, yes. Sustainability matters more than intensity.
Let me ask you about something I see advertised a lot: supplements. There are pills and powders that claim to lower blood pressure. Do any of them actually work?
This is an area where the wellness industry thrives on confusion. The evidence for most blood pressure supplements is weak to non-existent. The one supplement that has the strongest research support is potassium. But there is a major caveat.
What is the caveat?
Potassium supplementation can be dangerous for people with kidney disease or for those taking certain blood pressure medications, particularly ACE inhibitors and potassium-sparing diuretics. It can cause dangerously high potassium levels in the blood.
So people should not just start taking potassium supplements based on what they hear in a podcast.
Absolutely not. And that is why the DASH approach is safer. It provides potassium in the form of whole foods. The body regulates potassium from food much more effectively than from supplements.
What about magnesium or calcium supplements?
The evidence is modest at best. Some studies show small effects, but not enough to recommend supplementation over food sources. With calcium, there is some evidence that people with low calcium intake may see a benefit from increasing it. But again, food first.
Food first. I like that as a rule.
It is a good rule, and it applies broadly. The research consistently shows that whole food dietary patterns outperform individual supplements for chronic disease prevention and management.
I want to come back to the practical side. For someone who is listening to this and has high blood pressure or is borderline, what would you want them to do starting tomorrow?
I would want them to do 3 things. First, talk to their doctor about their current numbers and get a baseline. Second, make one DASH-aligned meal choice at their next meal. Third, go for a 15-minute walk after that meal.
That is 3 things, but they all feel achievable.
They are. And the research supports that even small changes produce measurable results. A 2017 study in the journal Hypertension found that a single 15-minute walk after a meal reduced the post-meal blood pressure rise in people with hypertension.
So even one walk changes things.
One walk, one meal, one day. That is how change happens.
Claire, let me ask you one more question. I know people who have been on blood pressure medication for years. Does lifestyle change mean they can stop their medication?
This is a very important question, and I want to be careful here. For some people, significant lifestyle change can reduce or even eliminate the need for medication. But this must always be done under medical supervision. Never stop or reduce medication without consulting your doctor.
So the goal is not to replace medical care.
The goal is to add lifestyle interventions as a complement to medical care. In some cases, the combination allows for lower medication doses, but that is a conversation between the patient and their healthcare provider.
That makes sense. I have heard stories of people who completely reversed their hypertension through lifestyle alone.
There are documented cases. The research on lifestyle interventions shows that some people can achieve normal blood pressure without medication, but the research also shows that individual responses vary greatly. Some people have genetic factors that make their hypertension more resistant to lifestyle change, and some people have secondary hypertension caused by an underlying medical condition that requires specific treatment.
So, lifestyle is powerful, but not guaranteed.
Powerful, but not a guarantee. And that is why the evidence based message is not lifestyle can cure you. It is lifestyle can significantly improve your numbers and reduce your risk.
I appreciate that honesty. It is more motivating to me than false promises.
That is the philosophy of this show. We do not overpromise. We tell you what the research actually shows, and we help you use that knowledge.
Let me pull together what I have learned today. The sodium myth is that it is the primary driver of hypertension for everyone. In reality, it affects about a third of people. The DASH diet, which focuses on potassium-rich foods, has about 3 times the effect of salt restriction alone. Weight loss of 5 to 10% produces additional benefit. Exercise, particularly a combination of aerobic and isometric training, further reduces blood pressure. And stress reduction through mindfulness adds even more.
That is an excellent summary. And I would add one more piece. All of these interventions are synergistic, they work better together. A person who follows DASH loses a modest amount of weight, exercises regularly, and practices stress reduction will likely see a combined blood pressure reduction that is greater than the sum of the individual parts.
That is the kind of information I wish I had 10 years ago.
You have it now, and that is what matters.
And if today's episode has taught me one thing, it is that I should stop blaming the salt shaker and start thinking bigger. More vegetables, more movement, more attention to stress. That is the real recipe.
That is the real recipe.
Thank you, Claire. This has been genuinely eye-opening.
Thank you, Robert. And to everyone listening, thank you for being here. The evidence is on your side. Use it.
If this episode helped you think differently about blood pressure, please share it with someone who might also benefit. And if you want to go deeper, we have episodes on DASH meal planning, the science of isometric training, and the research on mindfulness and heart health coming up in this series.
Subscribe to Longevity Lab so you do not miss them. And remember, knowledge without action is just information. Today's rule: at your next meal, add one vegetable you would not normally eat. That small choice is the beginning of change.
One vegetable at a time. I am starting tonight.
Good. I will be doing the same.
See you next time.